Should I use a telehealth Suboxone clinic? Telehealth services have become a popular option in recent years due to the convenience and cost-effectiveness they bring patients, no matter their situation or disease. In fact, the CDC reported in 2021 that 37% of adults aged 18 and above had used telehealth services in the past year, and it's predicted to rise even further in the future. One area where telehealth has seen a lot of activity is substance use disorder. SAMHSA reported that the percentage of substance use treatment facilities with telemedicine services increased drastically in 1 year, from 27.5% in 2019 to 58.6% in 2020. Therefore, it's no surprise that seeking treatment for opioid use disorder, or OUD, has become easier and more accessible with the help of telehealth services. But should someone suffering from OUD consider a telehealth Suboxone clinic? This video will discuss what Suboxone is and how it works, define telehealth services, discuss the pros and cons of using a telehealth Suboxone clinic, discuss our telehealth services, and how to get started with Suboxone telehealth services. Let's get started. Suboxone is a drug that the FDA approved for the treatment of OUD. It is the brand name of a combination of two drugs, buprenorphine and naloxone. Buprenorphine is an opioid medication that helps reduce cravings and severe withdrawal symptoms, while naloxone acts as a blocker of opioid receptors, preventing potential misuse. Suboxone is taken as a tablet or sublingual film. When taken correctly, it can be a helpful tool for patients to overcome their opioid addiction and live a healthier life free from opioids. Telehealth or telemedicine is the remote delivery of healthcare services and information using telecommunications technologies. It allows patients to consult with healthcare providers from a distance using video conferencing, phone calls, or text messaging. Telehealth has been used to provide mental health services, telepsychiatry, counseling, and OUD treatment, to deliver educational lectures and workshops, and provide follow-up care for patients after they have been discharged from the hospital. Telehealth has also been used to help patients manage chronic conditions such as diabetes and hypertension. In recent years, telehealth has been used to treat opioid addiction with the help of Suboxone clinics. Suboxone is a medication that helps reduce cravings and withdrawal symptoms in patients trying to quit opioids. Telehealth Suboxone clinics offer virtual visits with counselors and doctors who can prescribe Suboxone. These virtual clinics provide a convenient and confidential way for patients to get the treatment they need. Ultimately, telehealth is a versatile tool that can be used to improve access to care and increase convenience for both patients and providers. No wonder it's becoming increasingly popular in all areas of healthcare. Telehealth services for OUD are viable for those who may not have access to traditional in-person services or need more flexibility and convenience. The key benefits of using telehealth Suboxone clinics include the following: increased access to care, even in rural and remote areas; quicker access to treatment without having to wait for an appointment; the ability to receive treatment from the comfort and privacy of your home; reduced risk of exposure to contagious diseases, such as COVID-19; potential cost savings when compared to in-person visits; confidentiality and anonymity. Insurance coverage for telehealth visits may vary depending on the state you live in and your insurance plan. However, most major insurers, like Medicare and Medicaid, now cover telehealth services. However, you must consider some potential drawbacks. Telehealth visits may only be suitable for some, and some people may feel uncomfortable receiving care over video or phone. Additionally, telehealth visits can't provide hands-on treatments like physical exams or lab tests. It is crucial to speak with a Suboxone doctor before deciding if a telehealth Suboxone clinic is right for you. Telehealth Suboxone clinics offer a variety of services to help patients manage their opioid addiction and recovery process, including online Suboxone appointments allow patients to consult with a Suboxone doctor remotely. The doctor will ask questions about your medical history, lifestyle, and other relevant information before deciding if Suboxone is right for you. Once it's determined that you are a good candidate for Suboxone treatment, your doctor will explain the medication's benefits, side effects, and proper dosage. They may also provide additional resources to help you stay on track with your recovery. You may then have regular online appointments with your doctor throughout your Suboxone treatment to track and adjust your dosage. Virtual counseling and therapy sessions are also available through Telehealth Suboxone clinics. Depending on the clinic services, these sessions may be conducted individually or in a group setting. During these sessions, your therapist will help you develop strategies to manage cravings, cope with stress and other triggers, and make lifestyle changes that support your recovery. Medication-assisted treatment, or MAT, is a treatment for OUD that combines medication with counseling or behavioral therapy. At a telehealth Suboxone clinic, you may be prescribed Suboxone as part of your MAT program. This medication helps reduce cravings and withdrawal symptoms so you can focus on recovery without the distraction or temptation of opioids. MAT targets addiction's physical and psychological aspects, providing a holistic approach to recovery. It can also help reduce the risk of relapse and improve long-term outcomes for those struggling with OUD. At some telehealth Suboxone clinics, you may be able to receive same-day Suboxone prescriptions. It means starting your treatment immediately rather than waiting days or weeks to obtain a prescription. Same-day Suboxone prescriptions can be beneficial in times of crisis when time is of the essence and access to traditional healthcare may be limited. If you're considering using a telehealth Suboxone clinic, the first step is to search for one online. Fortunately, you won't need to look too far because our platform offers a comprehensive list of telehealth Suboxone clinics available in your area. Start your search by entering your area or zip code, and you'll be presented with a list of available telehealth Suboxone clinics close to you. You may also have the option to filter your search results by what type of services they offer, such as online Suboxone appointments, to ensure you find the right virtual clinic for your needs. After you've found the perfect telehealth Suboxone clinic, contact them directly to set up an appointment. You may be able to do this by submitting a form or by phone, depending on the clinic's policy. When you've contacted a telehealth Suboxone clinic, they will provide you with an appointment time and the necessary information to access their online services. It may involve downloading applications or special software to your computer or device for virtual sessions with the doctor or therapist. Choosing the right telehealth Suboxone clinic is essential to ensure successful treatment. Before making a decision, research the clinic's services, qualifications, experience, and reviews. You may also want to consider additional resources they may offer, such as virtual counseling, therapy sessions, or lifestyle advice. By using a telehealth Suboxone clinic, you can access the opioid addiction treatment and support you need without leaving your home. It has made it easier for those suffering from opioid use disorder to get the help they need to live a healthier, happier life. So if you're looking for an alternative to traditional healthcare, then a telehealth Suboxone clinic may be the answer. Remember that recovery is an ongoing process, and taking things one day at a time is essential. With the right help and support, you can overcome opioid use disorder and get back to living your life fully. Visit our website today to find the right telehealth Suboxone clinic.